I am David Krag, and I work with cancer researchers at University of Vermont and multiple institutions in the United States and outside the United States. Our goal is to develop new treatments for cancer using a patient's own immune system. Previously, I developed a technique, a method to very precisely target the lymph nodes that are draining a cancer. So, for example, breast cancer may drain to lymph nodes in the armpit area. And there's about 15 lymph nodes there. It used to be we'd just take out all those lymph nodes as part of the treatment for breast cancer. But now with this technique, we can isolate out the 1 or 2 lymph nodes that are the first place that the cancer might spread to. And so surgically, we can just do a small biopsy and take out 1 or 2 lymph nodes. That's vastly better than removing all of them. This has now become standard of care around the world, and well over 1 million women have had this procedure done that we developed. Now we want to take advantage of this ability to very accurately identify lymph nodes draining a cancer or a cancer vaccine to develop new therapies. Because we know that patients do develop an immune response to their cancer. And that starts in the lymph node. In the lymph node, there are very special immune cells that respond to the cancer or a cancer vaccine to develop antibodies that will then go to be anti-cancer bodies and attack the cancer. The problem is that even though these antibodies develop, they don't develop in sufficient amounts to actually make the cancer go away. We want to boost that up. We want to boost that way up. And so the way our strategy is to remove the lymph node using this radio tracer technique. And once we get our hands on that lymph node in the lab, we can now grow up those cells and produce antibodies in really an unlimited manner. And the idea is that we would take those antibodies that are now anti-cancer antibodies and give those back to the patients. And it might be useful even for other patients. So we are very near to the point of going into clinical studies. And in fact, we have patients that have advanced cancer waiting for us to finish our current set of research strategies to move this to the clinic. Kat Bordy, Linda Krag, Carrie Clement, and several others have teamed up with us to support this research to get it as quickly as possible to patients. We also expect that since antibodies are not toxic, our blood has lots of antibodies already in it, that it shouldn't be a toxic therapy. And that's what cast-off chemo is all about. So we would like to invite you to participate in this program to help support this research and bring this as quickly as possible to patients around the world. So thank you very much.